Good morning to everyone. I'm Mrs. R. Indumati, Head and Assistant Professor of Home Science, Sri Sharada College of Women, Salem. Today, we are going to see about the dietary management during fever conditions. First, we have to go with the topic inside. We are going to see about fever and overview. Different types of fever. In these different types, we have three types. One is acute fever, intermittent fever, chronic fever, and impact of fever on nutritional status, management of fever. That is about, we are going to see for the principles of management and some of the dietary guidelines and foods to be avoided and included, etc. First, fevers and overview. Generally, fever is an elevation in body temperature above the normal temperature of a body, that is 98.4 degree Fahrenheit, which occurs in the response of which causes fever, whereas which causes high temperature in the body and which is response to cause infection, inflammation due to any unknown causes. The fever might be caused by many of the factors. Here we have discussed about three factors. One is endogenous factor, exogenous factor, and certain inflammatory condition. First, we are going to say about the endogenous factor. So, what is endogenous factor? Antigen and antibody reactions due to malignancy or due to any new organ, that is graft projection. Exogenous factor due to some bacteria, fungi, and virus. And certain inflammatory conditions such as rheumatoid arthritis, any inflammation in the joints, which is called as symptom. Next, we are going to see about what are the different types of tea. Before to the types, we are going to see about the duration of fever. Maybe there are three types of duration fever occurs. One is short duration fever, another one is intermittent fever, and third one is chronic fever. This chronic is chronic duration. Short as an acute fever and cold, influenza like chickenpox, scarlet fever, tuberculosis. It is an acute infection which causes by some of the bacteria or viruses, which is termed as short-term fever, which is maybe the duration may be reminded, maybe the fever may be caused for 1 to 3 days. And next is the intermittent fever, which is example is malaria. The fever may last for 1 week. And next is chronic, that is tuberculosis. Maybe after 2 weeks or after more than 2 weeks, it is termed as chronic fever. It may last for several days to months. For example, TB and typhoid. This is chronic. And next, we are going to see about the mechanism of increase in body temperature. How the fever temperature in the body is getting increased. The maximum of increase in body temperature has been observed here and has been formulated. Exogenous and endogenous agent which activates the phagocytes in the body and which in turn it releases endogenous pyrogen. The pyrogen is a fever-inducing hormone which in turn will synthesize prostaglandin which stimulate thermoregulatory center in the anterior hypothalamus, which is situated in the brain, which increase the normal set of body temperature, which causes fever. This is the mechanism of increased body temperature. Thus, fever is regulated to new set point of body temperature. This is elevation in temperature from increase of heat production, for example, shivering, and decrease of heat, which causes peripheral vasoconstriction, etc. Some of the fever just always classified broadly in three main elementary categories. Due to fever of bacterial infection, fever due to viral infection, fever due to parasitic infection. These are some of the types of fever, maybe influenza, typhoid fever, chickenpox, meningitis, smallpox, viral hepatitis, malaria, measles, rheumatic fever, dengue fever, chikungunya, and swine fever. Next, metabolic changes during fever. Some of the metabolic changes occur in the body, we'll see one by one. The metabolic most important changes which may affect the nutrition are increased metabolic rate in amount of 7% for every degree Fahrenheit rise in body temperature, whereas decrease in glycogen store, accelerated loss of body in water owing to increased perception, the excretion of body waste will be increased seen, an excretion of sodium chloride and potassium, decreased in motility and reduced absorption of nutrient, increase in protein metabolism, which is especially excessive in typhoid fever and malarial fever, and also in other additional things which happens in the body is the additionally end products of protein metabolism, which is excreted as urea in the place, which causes a place of heavy burden on the kidneys. Next, we are going to see about symptoms of fever. The symptoms of fever is first is pain and soreness all over the body, but some limbs may be extra painful and sore thrust, loss of appetite. Some of the medications such as antibiotics, drugs are used to treat high blood pressure or seizures. Some of the immunizations such as diphtheria, tetanus, and acellular bursitis, that is pneumococcal vaccine, and heat exhaustion may be extreme sunburn, rise in temperature of body, of perception, of simmering, restlessness, and agitated temper. Some of the picture shows high fever, skin rashes, fatigue and weakness, headache, sore throat, running nose, nausea, vomiting. Sometimes the eye may be just reddish in the eyes, loss of smell and taste. These are the common symptoms of fever. Diet in fever depend upon the nature and severity of the pathological conditions and length of the convalescence. The body should meet the following needs of the nutrients. Dietary management. The dietary principles including the entry diet, which should be the principles of diet always should the fever is high calorie, high protein, high carbohydrate, moderate amount of fat, high fluid, and soft diet should be included in the included in the daily dietary management system. First of all, we are going to see about energy. The caloric requirement will be increased as much of the body temperature is increased. So as to clarify, the 50% of greatest increase of calorie requirement, which is because of greater tissue destruction and restlessness, so that the calorie requirement need to be increased. Initially, the patient may be able to ingest only 600 to 1200 kilocalorie daily, but this should be rapidly increased as possible when the digestion increases or the uptake increases. The protein is about 100 gram of protein, just more prescribed for the adult whenever the fever is prolonged. Will be efficiently utilized when the calorie intake is liberal. High protein beverages may be used as a supplement to the regular meal. For example, more amount of milk can be supplemented. Carbohydrate. Glycogen store, which is replenished by a liberal intake of carbohydrate glucose, a simple sugar, which is less than sweet, is readily absorbed in the bloodstream, which is preferred. It's a simple carb. Coming to the fat, the energy intake may be rapidly increases through the judicious use of fat, and about 35 grams of fat can be included. The fried foods may be retarded digestion, so as to avoid the fried foods. Next is about minerals. A sufficient intake of sodium chloride is accompanied by the use of soup, by liberal sprinkling of salt, fruit juices or relatively good in potassium should be included. And coming to the vitamins, fever apparently increases the requirement of vitamin A and ascorbic acid, just as complex vitamin, are needed to increase the level proportionate to the increase in calories. Oral therapy with antibiotics, which may drugs interfere the synthesis of some of the B complex vitamin by the intestinal bacteria, thus necessitating a prescription for the vitamin supplement the short term time. And coming to the main thing, that is fluid. The fluid intake must be liberal to compensate the dose loss from skin to provide adequate amount of volume urine for excreting the waste. daily. At least 2,500 ml to 5,000 ml is necessary in the form of soups, fruit juices, and water. Next is about ease of digestion. So still now we have seen about the nutrients. Coming to the ease of digestion. So what form we should give the diet to the patients. Bland diet is readily digestible. It is well cooked, should be used to facilitate digestion and rapid absorption. The food may be soft or a regular consistency. The fluid diet can be usually initiated initially and it is be continued. There is disadvantage. The fluid can be taken from the diet if initially they are facing some of the disadvantages which is given below. Most of the fluid diet occupy bulk out of proportion to the calorie and the nutrient so that the nutrient value so that the reinforcement with solid is more essential. The liquid diet sometimes increases the abdominal distension to the point of discomfort, whereas solid diets may be better tolerated. Many patients experiences less anorexia, nausea, and vomiting when they are in the solid foods. And coming to the time of feeding, which is termed as interval of feeding, small quantities of food at an interval of smaller time just ensure the adequate nutrient. The interval of 4 to 3 hours, the food must be essentially fed to the patient without overtaxing the digestive system at any time. With improvement, many patients consume more food, which is given for a 3 meal per bedtime feeding also. The duration of fever may be has been shortened by antibiotic and drug therapy and nutritional need may be met without any difficulty. During an acute fever patient, appetite is very poor, so that small feeding of soft or liquid diet is desired to be offered frequently and sufficiently the patient should take more amount of fluid and salt is more essential thing for the ill condition patient. If the illness persistence for the more than few days, high protein, high calorie food should be emphasized to the patients. The first type we are going to detail about the short duration fever. An example of short duration fever today we are going to see is about typhoid. The diet and typhoid of short duration. The typhoid is an infectious disease, an acute fever with a short duration. It occurs only in human. It is caused by the bacteria which is called as Salmonella typhi. The feces and urine of the patient or the carrier of the disease or the source of infection. Infection which is acquired by indigestion of food and indigestion of food and water, and which may be caused because of some of the positive factor which is contaminated food and water, and with the patients or a person which is recovered from those diseases. House flies transfer this particular bacteria from the feces to the and typhoid bacilli do not multiply in water but may survive about for 7 days in water. They may survive over a month in ice and ice cream, and typhoid bacilli may be grow rapidly in milk without altering any taste in appearance in any way. The vegetable roam in the sewage form, which is washed in contaminated water, which also have the positive results for this particular typhoid. And coming to the incubation period, the incubation period of a typhoid is usually 10 to 14 days, that is about 2 weeks. It may short as 3 days, or it may be long for 3 weeks. Depending upon the dosage of bacilli ingested in the body, the incubation period persists or persist. The symptoms is characterized by this diseases, continued high inflammation of the intestine, formation of intestinal ulcer, hemorrhage, enlargement of spleen, various patches of lymphatic tissue situated in the small intestine, or the seat of infection of typhoid fever. The patient may complain of diarrhea, constipation, and severe stomachache. The abdominal absorption of nutrient is decreased. The patient may feel headache with the anorexia. And coming to the principles of the diet, high calorie, high protein, high carbohydrate, high fluid, low fat, and low fiber, bland diet is suggested for the typhoid patient. For these types of acute and chronic and intermittent fever, the dietary guidelines may be the same. Some of the pattern of the fluids and fat condition will be getting changed. The principles of the diet will be the general consideration for the fever like short and intermittent. So the general dietary consideration principles of dietary management is as follows. And first, clear fluid should be followed by full fluid and a soft fluid. Liquid diet may need not meet the high calorie protein requirement. As the patient improves, the soft diet can be given, and liquid diet help in patient to meet up their water and electrolytic requirement daily. Because of the intestinal inflammation, fiber and spices must be eliminated in the diet. Refined cereals, bread, egg, boiled potato, simple desserts like custards and porridge can be given. Foods to be included like fruit juices with glucose, and coconut water, barley water, irritating with other spices should be avoided. And milkshakes, if there is no diarrhea, we can add milk products, custard and cream. Then dals, curries, eggs, baked fish, minced meat, curd, cottage cheese, and cheese, gruel, and steamed vegetable juices, milk pudding, and vegetable puree acceptable. The main thing, the diet should be very bland and non-irritating foods can be included in the diet. Next foods to be avoided is butter, ghee, vegetable oil, no harsh fibers, chili, pastries, fried foods, and puddings can be avoided, and harsh soups, there is no chilies, soups can be avoided. Adequate nutrition reduces the convalescence period. The next fever is about influenza. Influenza is acute infection, which is a short duration fever. It spread from person to person by contact with inhalation of viruses. The sneeze of cough or infected individual produces many droplets containing virus, and these may inhale by those nearby. Symptoms: the incubation period is about 2 days, with a range of 1 to 7 days. The onset is usually sudden headache and lassitude of malaria, shivering, and fever. The patient usually has a dry cough, frequent of sneezing or a sore throat. The illness is associated with a fever and usually lasts for 5 days. Bronchitis, pneumonia are the important frequent complications of this flu. The principles of the dietary treatment is same as fever condition, just to be followed for the influenza also. The next is about the second one is intermittent fever. Example fever is malaria. Malaria is transmitted from human to human by the bite of infected female Anopheles mosquito. Induced malaria occur due to congenital transmission, blood transfusion. Symptoms: typical malarial attack, so sequentially over 4 to 6 hours of shaking chill in the cold stage and fever of 41 degrees higher in the hot state at the sweating stage. The symptoms which is associated with include fatigue, headache, dizziness, slight diarrhea, anorexia, nausea, backache, dry cough, abdominal cramps, vomiting, etc. The acute symptoms have continued for more than 4 days or more. Splenomegaly, that is enlargement of spleen, usually appears. Foods to be included for this malarial condition is glucose water, fruit juices. There is no diarrhea, the same thing which we have seen for the condition of the short acute fever. Bread, boiled potato porridge can be included, and butter, ghee, fried foods, cream soup can be avoided. And in this condition, the spleen and the intestine part will get more affected. So as soon as the fever reduced, so more amount of fluids and soft diet can be included for the patient condition. Third one, we are going to see about the chronic fever tuberculosis. Tuberculosis is also called as TB, an infectious disease which is caused by the Bacillus mycobacterium tuberculosis. It affects the major part of the lungs, but may be also localized in other organs such as lymph nodes or kidney. Symptoms of pulmonary tuberculosis is accompanied by wasting of tissue, exhaustion, cough, and fever. In acute phase, high fever and increased circulation, respiration are present. The chronic phase is accompanied with a low-grade fever. Because of prolonged illness, considerable wasting of tissue may be present. As the disease progresses, the patient exhibits loss of appetite, pain in the chest, fatigue, weight loss is a major symptom, sweat, and persistent worsening cough. If the blood vessel is eroded in the lungs, the sputum may be streamed into the blood. That will be the ultimately results of insufficient damages occurred in the lungs and other vital organs. There is an increased catabolism of tissue protein, an increased loss in the sodium chloride, potassium, salt from the body. And dietary principles to be followed during the tuberculosis condition. The principles of diet is high calorie, high protein, high vitamin, high mineral, which should be prescribed for the patient. Full fluid, that is fluid diet may be given. Progressively, we can include soft, regular diets, which is improvement condition occurs. Coming to the energy, since due to the metabolic rate is not high as fever, other fever, the satisfactory weight can be managed with 2,500 kilocalories to 3,000 kilocalories. That is 40 to 50 kilocalories per kg of body weight in adult can be included in their diet, and 90 kilocalories per kg of body weight for children can be suggested. It is not desirable to gain more than 10% more than the ideal weight to the body frame in order to achieve desirable body weight to meet the increased demand for energy. High calorie diet per day is recommended. Coming to the protein, a protein intake of excess normal requirement is necessary in tuberculosis condition since the albumin, serum albumin level in case of advanced long-standing tuberculosis may low, that is 80 to 120 gram, help to regenerate serum albumin level, which is low. The protein is prescribed as 1 to 2 gram, that is 1.5 to 2 gram per kg of body weight in adult. And in the case of children, maybe 1 gram to be additionally added, that is 3 to 3.5 grams for children can be suggested. And coming to the minerals, the drugs used to treat tuberculosis which interfere the vitamin D metabolism, calcium should be provided liberally since it is need to promote the healing of tuberculosis lesion. At least 1 liter of milk should be taken daily. Iron supplement may be needed in their if having hemorrhages. Calcium, iron, phosphorus help in the regeneration of cells and blood fluids, etc. Vitamins and metabolism. The vitamins, the metabolism of vitamin A is adversely affected in the tuberculosis. Carotene is poorly converted into vitamin A. Hence, the diet should be provided with the vitamin A condition to be added to the diet. A weekly infusions of liver with supplementary dietary supplementation of vitamin A is essential. Ascorbic acid deficiency is present. An additional amount of citrus fruits and ascorbic acid supplementation is necessary for the regeneration purposes. To get an antioxidants of high servings of different vegetables and fruits should be supplemented. The vitamin B6 is also recommended. Some of the dietary guidelines and management to be followed during the tuberculosis condition. Foods should be bland in flavor, non-stimulating, easily digested food should be given since the patient who have the poor appetizing. Food must be very appetizingly added as a soft diet during the acute stage of high calorie fluid fluid and soft diet is prescribed, followed by the high calorie of soft regular diet and good quality of protein like 1 liter of milk and 3 to 4 eggs should be given to the patients. Initially, the small quantities of fluid should be given once in 3 hours. When the fever decreases, the interval can be increased to 4 hours. 2 to 3 servings of different types of foods can be added to meet the micronutrient and antioxidant requirements. As the patient progresses, normal, attractive, palatable food should be given. The patient should come back to the ideal weight, ideal weight, all over the overall rest, fresh air, and good nutrition are the key elements the recovery from tuberculosis. And thank you for one and all for the patient listening. We have some of the quizzes to be orally said. Okay, we'll see by one. You know the answer, you can post in the comment box. My first question is, how many types of fever are there? Option A, 3, 2, 4, 1. Yes, you can use your comment box with first question. Okay, we'll proceed to the second one. Name the bacteria which causes typhoid. Name the bacteria which causes typhoid fever. Option A, Salmonella mycobacterium. Salmonella mycobacterium. Yes, we can proceed to this third one. The energy level for the tuberculosis is about 2,500 kilocalorie to 3,600 to 1,200 and 1,200 to 2,400. And you can post your answers in the comments. Name the fever-inducing hormone. Name the fever-inducing hormone. Option A, estrogen, progesterone, pyrogen, progesterone, and pyrogen. The last part of the thing. How many liters of milk should be included in the diet of tuberculosis patient? How many liters of milk should be included in the patients of tuberculosis diet? Half liter to 1 liter, 1 liter to 2 liter, 3 to 4 liters. Thank you for the patient listening. Thank you, one and all.